Hello, everybody. My presentation is called Stigma and Discrimination in the Context of People Who Inject Drugs. Russia has the highest number of people who inject drugs in the region, 1.8 million, about 2.3% of the adult population. About 1 in 4 people who inject drugs are HIV positive. The proportion has reached 64% in some urban centers. Agonist treatment with methadone or buprenorphine is banned in Russia, even though multiple studies found it to be an effective means for opioid using PWID's linkage to HIV and other healthcare services. Harm reduction services, though legal, are insufficient for provision PWID with low threshold services. Due to the separation of care organization in Russia, narcology facilities offer no HIV care capacity beyond testing. To access HIV care, people who inject drugs need to attend a separately located HIV clinic. Consequently, only 20% of HIV positive PWID in Russia receive ART, and only a fraction of all people, 6% on ART, are people who inject drugs. Stigma has been increasingly recognized as a structural barrier to accessing HIV care and other health services. Some people PWID experience multiple stigma, being also HIV positives and/or MSM or sex workers. Studies in Russia have documented that unfavorable attitudes toward both people who inject drugs and people living with HIV are common in healthcare settings. Policing practices involving people who inject drugs, such as unjustified arrest, planting of false evidence, verbal harassment, and coercion also exacerbate stigma that this key population experiences. Likewise, Russian people who inject drugs report frequent experiences of discrimination from personnel in healthcare settings, leading to mistrust even among PWID towards providers in the medical system. Personal factors such as substance use, health and illness perceptions, misconceptions about ART, and economic constraints also influence the linkage to care. As a result, HIV positive people who inject drugs with both high HIV and substance use stigma had poor health outcomes and lower access to HIV and addiction healthcare services. Thus, a study conducted in St. Petersburg found that both forms internalized stigma were associated with poorer self-rated health, high symptom count, lower likelihood of receiving regular HIV care, and lower likelihood of receiving drug treatment within the past year. Now, while negative aspects of stigma are well known in research, and I have just told you a little about it, there are some positive aspects to it. So I will now tell you about our pilot study, which is called A New Generation of Drug Users in St. Petersburg, Russia, HIV, HCV, and overdose risks in a mixed method pilot study of young hard drug users. So this is even though it's a small mixed pilot study, it's still, its results is a good illustration of the point I'm going to make. There were 4 participants in the quantitative subsample and 10 participants in qualitative subsample, and we used our quick HIV self-test as a means to determine our participants' HCV and HIV statuses. Our theoretical approach is drug generation theory, according to which drug generations succeed each other when a previously fashionable drug falls into disrepute. Thus, drugs are considered as something akin to fashion goods. There is a wave-like structure of drug epidemics. First, some drug becomes fashionable and popular among young drug users, but at later stages, its use becomes stigmatized among new initiates. So this is the picture that describes basically all drug epidemics. And we see in the picture, so in the beginning of the epidemic, there are low incidence and low prevalence of use of a particular drug. And in a later stage, there is low incidence as the drug falls into disrepute by high prevalence of this drug use, as drugs are not fashion goods in the proper sense, and you can't just forgo use of drugs as you can throw out unfashionable shoes. So, as I said, this is the case with all drug epidemics. For example, crack epidemic in the US in the 90s, in the 80s, in the 90s. And we see how this is happening with opioids in Russia. The main driving force of the change in drug using trends is stigmatization of users of the unpopular drug inside drug using communities, currently opioids in Russia. It is often accompanied by stigmatization of route of administration, injection drug use in the Russian case. And even among those who do inject drugs, people who inject drugs, sharing needles, which is associated with old opioid users, is heavily stigmatized. So there is some data from our study, and this is both, I will provide some both qualitative and quantitative data, and this is qualitative data, and we see from this quote stigmatization of opioid use. You know, heroin, hepatitis C, and HIV, it is one direct line, says Vika 21. And the second one, they, his friends, shouldn't have known that I use drugs, heroin. So therefore I hid it from them. It is heroin. Heroin remains heroin, doesn't matter how we use it. A fearful word, narrates Anton 25. And we'll also see stigmatization of syringe sharing. Another quote from Roman. People tried, if somebody didn't have a syringe, people gave him syringes, clean, I mean, that has helped him in order to exclude a possibility for someone to degrade. That's how they describe syringe sharing, degradation. Sometimes somebody would say, why? Don't do it. A pharmacy is just 5 minutes away. Go, I can give you the money. And another one, and they, if they present, and if you just use a syringe a second time, even if your own syringe, they can just throw you out, won't let you do it, syringe sharing, even if it's happening at your own house, tells Ksenia. Another quote from Rama, sometimes syringes were left at place and you can see it's full, but if it was not mine, I refused to use it, which is very uncharacteristic of the previous generation of opioid users, when it didn't matter whose syringe it was. The main urge was to get a fix. And the quantitative data corroborates our qualitative findings. So we see the high stigmatization of syringe sharing. 72.4% of our sample felt very strong aversion to people who use their friend's syringe when they don't have their own, and even more, like around 90% felt this kind of aversion for people who use the syringes of strangers. We also see a stigmatization of HCV positive and HIV positive people. 24.1% felt aversion to HIV positives and 7% to HIV positives. And interesting, as you see, the aversion to HCV positives were stronger, significantly stronger than aversion to HIV positives. And we explained it that in their social networks, they didn't have HIV positive people, but they had some HCV positives. So they perceive HCV positives as clear and present danger to them as compared to HIV positives, who are basically more stories from the news. And also we can see that the interaction with the old, like not older than 90, we operationalized this generation opioid users. So around 90% never or rarely interact with them. And we see also that in their practices, as a consequences of this stigmatization, around half of our sample used only new syringes, and no one reported, of course, it's reported data, self-reported data, use other people's syringes. But the picture with the drug paraphernalia sharing is more disturbing, as only 27.6% never shared drug using paraphernalia, as spoons and cottons and stuff like that, in the past 12 months. And also disturbing is the use of condoms. We see that only 13.8% consistently always used condoms in the past 12 months. So now I'm going to conclusion, and we can see that stigma related with drug use has a range of detrimental consequences, particularly when it comes from the authorities and healthcare workers. Stigma has some positive aspects when it functions within drug-using communities. It leads to avoidance of some dangerous drugs, now opioids in Russia, by young drug users, injection use, and syringe sharing. Though the sample was small, the discrepancies between the new users and the old, 0% versus 65% on HIV and 7% versus 95% on HCV, can hardly be attributed to mere chance. High stigmatization of the older group of opioid users and behaviors associated with them, such as syringe sharing, make this age cohort to be relatively protected from HIV and HCV infection by a slow level of interaction with the older group, which is the potential source of infection. This generation is also opioid aversive in comparison to older cohorts. Thus, this generation of drug users can be called stimulants generation, given the rapid spread and popularity of stimulant type new psychoactive substances. The pilot data gives some confirmation to the theory of drug generation's change. However, given the small sample size, these conclusions are very preliminary. But apart from our data, we also have, of course, some other data sources, as sites from the darknet and other sources that kind of attest to the emergence of this new generation, even though further studies should corroborate this and explicate its parameters. However, positive aspects of stigma that change community norms to the better come with the price: stigmatization of HIV and HCV positives. Disadvantaged status that users of stigmatized substances have may lead to these users' shame, guilt, and hopelessness that were consistently found to be barriers in access to HIV and other health services. And you can learn, if you're interested more on this, in our paper, and there's the title again. And thank you for your attention.